All right, Assalamu alaikum, everyone. Thank you so much for joining our webinar about diabetes and health in Ramadan during the COVID-19 crisis. My name is Maryam Hussein. I'm the Vice President of IMANA, and we're just very privileged to have you as a part of this discussion and this important topic as we are about to enter the holy month of Ramadan, and as we also continue to face this pandemic that unfortunately is still persistent. So we, alhamdulillah, have a great array of speakers today who will be providing information for all of you. This is a recorded webinar, so inshallah, if you have any questions, we'll be able to provide an opportunity where people can ask questions later to our speakers as well. So without further ado, I'd like to introduce Dr. Luma Ghalib. She is an endocrinologist who has been helping out with IMANA, and she will be the moderator for this session. Dr. Ghalib, thank you.
Thank you, Dr. Hussein. It's been a privilege to be part of this organization and being part of an important discussion that we're all going to be working with in the next coming month in Ramadan. So we all know the blessed month of Ramadan is a unique month of our year. It helps us to find inner peace. It helps us to control our desires, teach us self-restraint, and usually lead to a healing process of the inner peace of our soul. The recent literature, especially from endocrinology point of view, there's been a lot of data coming up as the blessed month of Ramadan actually can be healing and helping physiologically our bodies at the same time, not just our soul. And being an endocrinologist, we're all excited and tuning closely to the new discovered benefits of the fasting. And even non-Muslim people these days are embarking on all sorts of different ways of doing the intermittent fast to help with insulin resistance. Although the net weight typically does not change, but there are a lot of effects on the body. I'm pleased to introduce Dr. Hassanein. He's a consultant endocrinologist in Dubai. He is a leader in this field of effect of fasting Ramadan on the body, on the health of fasting. He's a leading author for more than 70 papers, and he is actually a special advisor to the ADA, the American Diabetes Education, and he is a leading author in the practical guidelines that's published through IDF and DAR, Diabetes and Ramadan, that we all use when we're doing education especially in this country. In the Western world, we don't have a lot of data to support what we advise our patients. If you are a Muslim physician, the discussion is a bit easier with your diabetic patients around Ramadan. But if you are not a Muslim physician, the circle of trust and link between you and a diabetic Muslim patient, it becomes a bit interrupted. Because they, at least from a diabetic person, not sure if they know how heavy the month of Ramadan is in our religion and how important it is. And that's when we need our imam and sheikh to help us connect all the dots. So without further ado, I'm going to introduce Dr. Hassanein. He had an amazing presentation regarding Ramadan and fasting and special slides about the effect of fasting and the COVID epidemic that we're having.
Okay, thank you very much for this kind introduction. It's lovely to be with all of you. I'm very impressed with your activities, and unfortunately, because of COVID-19, we could not meet face to face. But inshallah, in the future, we can collaborate and together for the help of all our patients across the globe. So what I will try to do during my presentation is first share with you some of our thoughts about the issues related to a diabetes person during the time of COVID-19 and before Ramadan and during Ramadan, and then go quickly through some of the highlights of the assessment and management of a person with diabetes wanting to fast the month of Ramadan. So not long ago, the ADA had on their website these sort of questions and answers. And the first question was a concern for many of the people with diabetes on whether they are at higher risk of getting COVID-19. And their simple answer is there is not enough data for this. In fact, the data actually coming from the meta-analysis in China is showing that people with diabetes, the prevalence of them among those positive for COVID-19 is the same as the general population. But the second very important question is really quite the main issue that we need to think of, which is, do people with diabetes have a higher chance of experiencing serious complications from COVID-19? And unfortunately, the answer is yes. They do face a higher chance of experiencing this. So what we really know now is that they do have a higher chance of getting serious complications. The question is why? And of course, we know in general terms that people with diabetes are more likely to experience severe symptoms and complications when infected with a virus, any virus. But then also that this is linked primarily to two things. One is the blood glucose level, if it's high enough, and the second is the presence of other comorbidities together with diabetes that will make the person's immunity a bit compromised and consequently fighting off the infection, such as the COVID-19 infection, would be difficult. But what we also know as the positive point is, if a person with diabetes is well controlled, well managed with regard to blood glucose level, the risk of getting COVID-19 severely, in a severe form, is pretty low, and it would be as good as the general population. So from a practical point of view, what can a person with diabetes do now before Ramadan and before we consider fasting is, of course, number one, is to avoid the risk of being in contact with a positive person. So stay at home. And then, of course, to follow the general advice of COVID-19 about the hand washing and the facial, the mask and what have you. But certain specific points for a person with diabetes related to the blood glucose control are really required, which is to avoid, I mean, it's quite easy when a person sitting at home being bored, being stressed, to overindulge in food, especially with the reduction in physical activity. Of course, regular physical activity could be done at home, but it's easier said than done. Regular glucose monitoring is really key, specifically for those on insulin, where they might need to check ketones as well if the blood glucose level is high. If there is any infection of any type, cold, whatever, then of course any hyperglycemia related or any dehydration related to the infection need to be promptly treated with enough therapy to control the blood glucose level and enough fluids that to overcome any possible dehydration. Of course, a person with diabetes needs to stock enough of their medication and enough of their blood glucose monitoring tools. And it comes without saying, if there is a problem, communicate with your diabetes team. And luckily now, as we are now communicating virtually, a lot of people in the US and across the globe are communicating with their health team virtually. But what about Ramadan fasting itself? Is Ramadan fasting an issue? So the first question is it safe for a person with diabetes to fast Ramadan or not? And the simple answer is the vast majority of people with diabetes can fast safely. However, there are some exemptions. Some people who are advised not to fast. This, in general terms, is a discussion between the patient and their healthcare professionals, and there are guidelines and documents for this. And the latest one with the IDF also include the religious opinion of the Mufti of Egypt, who's a professor from Al-Azhar University. We usually have a risk assessment based on the safety of fasting regarding avoiding hypoglycemia, avoiding hyperglycemia, or worsening of an existing medical condition, cardiac, renal, infection, and so forth. And in all the guidelines, the people who are at a very low risk are those who are well controlled and treated with oral therapy or a GLP-1 receptor agonist or basal insulin. The other people who are not well controlled or are treated with intensive doses of insulin, or those who have other comorbidities, including frequent hypos or hypo-unawareness, are at a very high or high risk of fasting in general terms. So how does this link with COVID-19? Well, we have just stated the link between hyperglycemia as well as other comorbidities to the link of having a serious medical condition. During Ramadan fasting, some people are already advised not to fast because of hyperglycemia. There are some also are advised not to fast because of the existing of other medical conditions. What we don't want is that Ramadan fasting, with maybe socializing and overindulging in the big meals, or the excessive reduction of blood glucose lowering therapy, that the person would end up with hyperglycemia, plus or minus any other comorbidities they have, and then if they attract the virus, they could end up with a florid form of the virus. So who are the people we need to tell them they need to think again and again and again about fasting? They are already among the group of high or very high in all risk of fasting in the guidelines. This is a person with high resistant blood glucose, a person with a recent ketoacidosis or admission with very high blood glucose, the hyperosmolar status. Obviously, a person with diabetes with a cardiac, renal conditions or food infections. An elderly person with diabetes who is with poor health on top of his age, and as well as those with acute illness, specifically respiratory illnesses. So all of these people are advised, please try not to fast this year. You can compensate later in the year or future years. What should people with diabetes do if they are well and they wanted to fast? Well, they need to take extra care about their food to avoid overindulgence and to try to avoid excessive glucose or fat intake and end up with hyperglycemia. Regular monitoring of the blood glucose is really very important during the fasting as well as the non-fasting hours, and probably the non-fasting hours are equally important here in these circumstances. Drinking plenty of fluid, unsweetened fluid during the non-fasting hours, the blood glucose monitoring, and accepting that I must stop my fast if my blood glucose level is a bit too low or is a bit too high, to be able to correct and act upon these figures. And of course, if the blood glucose level is high because of other related conditions. And of course, a person who ends up with some of these problems should not resume fasting straight away. They need to only resume fasting when things have settled and the blood glucose level has settled. So this is our opinion, and this has been consulted with eminent diabetologists for a number of countries, namely Pakistan and Egypt, with three of the senior colleagues, as well as other colleagues in the Gulf, and they have all felt quite comfortable with this statement that it is shared with you today. But going back to general care of a person with diabetes, and it's quite important and still is related. Most of my advice for you tonight is related to or extracted from the guidelines of the IDF with GAR. We know that the vast majority of people are pretty passionate to fast. This is the latest study from 10 countries in the Middle East and North Africa region, including Pakistan. And as you can see, in blue is those who attempted to fast over 15 days, and in red is those who completed the month fasting. And it's clear that while everyone is passionate, there is a very good proportion, roughly about 50% are unable to complete the month fasting because of their health. What can you as a healthcare professional do now is a quick assessment and a quick advice for the person regarding the risk, their advice about when to monitor and how to monitor, the food and the dietary during Ramadan, the timing of exercise, the adjustment of the necessary medication, and of course, the important advice of please break the fast if your figures are out of control, such as hypoglycemia or significant hyperglycemia. This assessment will help the physician, if it's done early enough, to be able to advise the person on their level of risk and on the frequency of monitoring, because monitoring in Ramadan is really essential for hypoglycemia and for hyperglycemia. Here are the main times that a person should monitor. We're not, of course, saying that the person should monitor 7 times a day. That might be required for someone on intensive insulin and insisting to fast. But there are certain times of the day, such as the late afternoon, that is really quite important, because that's the time of the highest risk of hypoglycemia. Post means, of course, for education, for postprandial glucose. Education is key, and when we did education in a number of places, including UK and in the Gulf, it managed to reduce the risk of hypo compared to pre-Ramadan, and unfortunately those who did not, their risk of hypo increased. One of the important points is what you eat for suhoor. You want to eat food that lasts. Having carbohydrate at suhoor, for example, having a bowl of cereal, it might be very healthy, but it would not last long enough. And then the person during the early hours or the mid-morning would be already at baseline of his blood glucose level with no increments. But having enough protein and fat and fiber among a small amount of carbohydrate would allow the blood glucose not to peak too long, but will last a lot longer. So adjustment of the medication is really quite important, and that's very important for us to stress upon all people with diabetes, but also the changes in the lifestyle and not overindulging. Now, medication is important because what we saw from the Darmina study is the risk of hypo, as you all would predict, is related to what treatment amount. So if people are on treatment, that oral therapy that does not include sulfonylureas, then the risk of hypoglycemia is pretty low. If they are on sulfonylureas, it doubles up. And if they're on insulin, it further doubles up again. So that's why it's important that we think of these medications and adjust them to minimize that risk. Str2 inhibitors is an important class of therapy for people with diabetes, specifically nowadays for the cardiovascular protection and the renal protection. Of course, they also have benefits for weight and little risk of hypoglycemia. But we also know that part of their side effects is excessive thirst as well as urea, and the risk of other problems such as DKA and genitourinary and urinary tract infections. However, in the studies that we've done, and we have done now 5 different studies, 3 have been done on dapagliflozin and canagliflozin, and 2 more studies were done on every SGLT2 inhibitor that is available for us. And the overall consensus from the studies is hypoglycemia will be lower than comparative drugs such as sulfonylurea. The person will feel more thirsty, that's a given, but it's not excessive to the extent of them stopping the fast or stopping the medication. And it has not had any impact on volume depletion or on renal function. The adherence rate was very good, and there was no reported DKAs or infections or hospitalization. So we say they are safe, but be cautious with the elderly, with those with renal impairment, those with hypotensive tendencies, those at excessive risk of dehydration, maybe by virtue of their job or working in heat, and those taking a diuretic. The best time for it is at meal time, which is iftar and they should no need to reduce the dose. This is a CGM data from comparing Ramadan with out of Ramadan, which highlights to you what I've mentioned earlier. The highest risk of low blood glucose level is in the late afternoon. And then, of course, there's the peak afterwards. And that is something we need to think when we think of treatments, for example, such as insulin. I've shown you here that persons with insulin, the risk of hypoglycemia doubles up from 10 to 18. So we need to be conscious about this. Sulfonylureas, they're not all the same. Downhill or glibenclamide causes a lot of hypoglycemia, and that needs to be either replaced or halved and given at iftar. Glimepiride and glipizide, I know that in the States you don't have gliclazide, which is the best of sulfonylureas, but the others have a better profile than glibenclamide, which is, I think the trade name for it in the States is Downhill. GLP-1 receptor agonists, they are very good. They are important class, specifically still for the heart and the kidneys and the weight. And with their pharmacodynamics, they cause very little hypoglycemia and they reduce the appetite. So they're quite suitable during the month of Ramadan, and the studies have supported this. But initiation of GLP-1 usually is associated with some GIT side effects for the following 6 weeks or so. So I would not initiate a GLP-1 pretty close to Ramadan. If it's a must to initiate, then I need to reduce the dose even beyond the prescribing dose, if necessary. Again, talking about insulin, remember that the incidence of hypoglycemia is highest from midday until the evening. And this has been shown on one of our studies that we've done on CGM patients, on 180 CGM patients. So we need to think of how we reduce this risk of hypoglycemia with food as well as with reduction of insulin. Basal insulin taken at evening meal at iftar and reduce the dose by 15 to 30%. If the person is on twice daily basal insulin, then normal dose at iftar and 50% of the dose at the suhri or the suhoor. Short-acting insulin, the evening meal time to match the carbs, the suhoor to match the carbs, but reduce it by 25 to 50%. And if the person will have a third meal at around midnight or close to, then maybe they can have also a small shot of insulin. You don't use too much of premixed insulin in the state, I think, but if you did, and if it's once daily, take it at a normal dose at iftar. Twice daily, then reduce the second dose by 25 to 50%. With all this, the key is to empower the patient with a simple algorithm. Put the targets that you feel you're happy with your patient, but give your patient a target. And if they achieve the target, no change. If they're lower, reduce. If they're higher, increase. And if they do this every 3 days or so, they should be able to sustain good control. And as I said in the beginning, glycemic control nowadays is really quite important to fight the risk of florid infections such as the COVID-19. Basal insulin is different than intensive. From our CGM study, it's quite clear, as you can see here, the rates of hypoglycemia is double, the duration of hypoglycemia from 47 to 86. So a person on intensive insulin needs to be advised that they are high risk and they should avoid fasting. If they insist, then of course they need medical care. I would like to finish by highlighting to all of you that we have a wealth of information on our website as well as on our app. We have two of them, two of the apps. One is for healthcare professionals called DAR Academy, and the other one for our patients, which is called DAR Safa. So if you log in on Google Play or on the App Store and you write DAR Safa, you will be able to download the patient app. And if you write the DAR Academy, you will be able to download the healthcare professionals app. They contain a fair number of information and videos and Ramadan nutrition plan and lots of guidelines, lots of information for everyone. So I would like to finish by summarizing that a good assessment before Ramadan that will include evaluation of the risk, providing the patient with the necessary tools for self-management, and the specific education that is tailored to the individual. Tailoring, of course, the treatment is quite essential. And of course, having a post-Ramadan follow-up is really quite important, that you look into this and document what happened during this coming Ramadan, so that it will be a good feedback for following year Ramadan. I'd like to thank you all for this, and I look forward to any questions that you have now.
Well, Jazakallah khairan for an amazing presentation. It's always been a wealth of information to see your slide. I've reviewed a lot of the studies that you did, and we were hoping, as you know, to get connected with the Endocrine Society. Inshallah, we can do it next year to get your information out to a lot of other physicians that's here. I'm sure a lot of the IMANA audience are a mix of physicians and patients with diabetes and people who deal with that on a daily basis. It was refreshing to know that a lot of the newer diabetes medication, the SGLT2 and the GLPs that we use quite a bit here in the United States to be very safe to use during fasting in diabetics, and not having a lot of hypoglycemia. I'm just going to name some of the medications that we use here and the brand name that we use in the United States, so for the listeners to understand what you were referring to. So for the SGLT2 group that you showed on your slide, most of the medication where you use here are Jardian, Farxiga, and Invokana. And these sounds like that did not cause significant dehydration and hypoglycemia, but need to be aware to keep hydrated. And the other group of medications that you mentioned, GLPs, these are the once weekly injections that in the United States here we use the name of Trulicity or Ozempic. It sounds like they're safe to use and they can help. The caveat is not to start them just before starting Ramadan. The other thing that I'd like to highlight here in America and a lot of the Western countries, a lot of, including my patient, and anybody with diabetes who see like their primary care or endocrinologist, a lot of them don't even mention to their physicians or endocrinologists they are Muslim or they're fasting. And I hear that when I precept the fellows who are not Muslim, and they already finished the visit and they didn't even mention to them that they're either fasting now or they're planning to fast. It's just there's this taboo that people don't like to share, open up and share that information. So I will encourage all our diabetics is to open up, send my chart message, or when you're going to do your televisits with your provider, share with them that information. A lot of the general American population know about Ramadan, and the media is trying to reach out to everybody to know what Ramadan is. But if they don't, you can tell them what will be entailed, how many hours you'll be fasting, and be in contact, sending them the blood sugars and all that. So I just want to highlight a few things that's in like that here in the United States. I'm sure probably you may have an open question Q&A session when we present the slide, if that works. But I'm sure that a lot of people on their mind, diabetic or non-diabetic, they're going to think, would fasting affect their immune system in a good way or a negative way? I'm sure that's on everybody's mind, especially for diabetics, but I'm sure everybody is having this thought in their mind. I know that's a hard question, and this is really not an endocrinology question. This is more immunologist and infectious disease, but I'm not sure if you come across any of the literature that may say either way.
Thank you very much for all your comments. They are all very valid comments, and for the explanation of the therapy, obviously for the non-healthcare professionals, and also for your important question about the immunity during fasting. I had the pleasure of co-sharing in some of the presentations and the articles on this, as well as had the pleasure of listening to much of this presented recently by colleagues during our Diabetes and Ramadan conference. And indeed, the vast majority of data show a healthy person, when they fast, their immunity is better rather than worse. And that's also is reflecting on the fact that ADA has said that a person with diabetes prevalence to have the infection, such as the COVID-19, is not higher. Now, when you look into fasting itself, so if the person is healthy, or if the person has diabetes and they are not with other problems, such as the high glucose levels, which can make them attract infection easier, or if they don't have other conditions on top of diabetes that makes the problem double whammy, such as the heart conditions or the... So the data we have that simple fasting is good, but we also know that for people with diabetes, it could be a challenge to complete the fast. Part of the problem is the therapy. Sometimes the therapy can cause hypoglycemia, and the passion of the person to fast make them reduce the therapy too much, and then they end up with the opposite, which is hyperglycemia. Hyperglycemia is not good for one's health, and we need to avoid this.
Yeah, thank you for that. And I'm just a comment, what we've been getting some information from New York data with all the COVID patients. What we've been told that a lot of these types, like diabetics, who are not very well controlled, when they get the COVID, they show severe insulin resistance, and they end up on insulin drips with very, very high dose of insulin. So just sharing information for other physicians who are listening, just to be prepared, that may start happening. We've been blessed that we do not have a lot of cases here in Ohio, but it could be just a matter of time. So just for all of us to be prepared and know what's going to be dealing with. I think I will move on to introduce our chef. So that's a matter of time, and we can always discuss other issues if it comes up. So I have the pleasure to present Dr. AbdulHakim Mohamed. He is a wealth of information, and he graduated from Notre Dame, and he has a bachelor's degree in Islamic studies from Sana'a University in Yemen, and he brings a wealth of information to IMANA community. And I think Dr. Maryam Hussein is going to introduce the webinars that you, Jazakallah khairan.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for having me here. It's an honor every time I attend with IMANA for their activities. I feel like my family is growing and growing, and today we just met another wonderful brother. I'm honored to meet Dr. Hassanein. May Allah subhanahu wa ta'ala bless you. And I'm touched by you're willing to even wake up at 4 a.m. That's incredible how amazing people we have in our community that are very close to the people, even though those people do not know them. When it comes to Ramadan and its relationship with us, Ramadan is a special month for us as Muslims. It's a month that we reflect that the Quran itself was revealed. It has a night that surpasses Alf Shahr, many thousands of months. The month of Ramadan is closer to us also because we feel we connect with the less unfortunate individuals in our society, and we reach a hand, a helping hand for those who are in need of sadaqah, in need of help. It's a month of cleansing, not just physically, but spiritually before that. The Sahaba themselves, they used to wait for the month of Ramadan 6 months, and when it finishes, they would feel saddened for the next 6 months. It lived with them throughout the whole year. It wasn't just the 9th month of the year that they sensed it, but it was in their hearts throughout the year. The Rasul sallallahu alaihi wasallam, his attitude even changed during the month of Ramadan, the way he attained his religious practices as well. His generosity will just bloom during the month of Ramadan. Like Aisha has said in the hadith, the authentic hadith, the Rasul sallallahu alaihi wasallam was generous, but he was most generous in the month of Ramadan. كان أجود ما يكون في شهر رمضان. كان أجود من الريح المرسلة. He was more generous than the wind, that flourishing wind that brings that cloud, that brings that rain. So Ramadan is not to be taken lightly by us Muslims. It is something that's embedded in our blood, in our identity, in our character. Even those who are less practicing Muslims throughout the year, when Ramadan comes, you can sense them that they get into another level of connection with Allah subhanahu wa ta'ala, a connection with their faith. Add to it that Ramadan is really a family time. We sense all of our families come together, they connect, our communities also come together, we share a meal. You know, every night is a night of sharing a meal. Every night is a night we stand together and pray. Every night and every day is a sense that we belong to something special. Even Allah subhanahu wa ta'ala looks upon it into something that's unique. Every religious practice we do, he says that you're doing it for yourself. But when it came to the fasting, he said, you're fasting for me, and I will reward you for it. الصوم لي وأنا أجزي به. So from point A, when we're talking about Ramadan is special. It has a higher place in our hearts and minds and faith. But when it comes to a person's health, then we need to look into this from a more deeper point. I want to state that there are necessities in Islam where they need to be maintained, and each one of them cannot jeopardize the other. They have to coexist all in equal levels, which is the protection of one's faith, the protection of one's health, the protection of one's mental capacity, and the protection of one's honor, and the protection of one's wealth. All of these five necessities have to exist, and not one of them should compromise the other. And if there is one that compromises the other, then we need to balance which one comes first, or which one should oversee the other. And when it comes to our faith can only be as strong as we are physically and mentally. And that is why our scholars in fiqh, when they mention the conditions of our practices, our salat, siyam, zakat, and hajj, they would mention that we have to have the right mindset and the right physical capacity for us to practice our faith. Because the idea of practicing your faith is you fulfill it. You practice it to the best of your ability, to the best that it can be. Halfway through usually is not what Allah subhanahu wa ta'ala wants us to do. Allah subhanahu wa ta'ala wants us to fulfill whatever we do. Allah subhanahu wa ta'ala loves for his servant to fulfill his ibadah. And if that ibadah is not fulfilled because it's jeopardized by something out of our ability, then it would be taken accordingly. It will be accepted accordingly. So for example, if I wanted to do Hajj, it says, "Man istata'a ilayhi sabila." Our scholar said sabila is a financial capacity as well as the safety in financial capacity. So if you can't find the financial or safety capacity to go to do Hajj, you're not required to do so. And you will be rewarded as if you did, if you had the right intention. The whole objective of it is that you put your heart and mind and will to go. And if you're still not able to go for reasons outside your capacity and your ability, without your intent not to, then you will be rewarded. And if we're talking in the matter of what we're talking about right now, which is siyam, fasting the month of Ramadan, may Allah subhanahu wa ta'ala allow us to live long enough to see the month of Ramadan, and may Allah subhanahu wa ta'ala help us fulfill the month of Ramadan, have us come out of the month of Ramadan better than we entering the month of Ramadan. And we find in the Quran al-Kareem that Allah subhanahu wa ta'ala, first of all, obligated fasting for all Muslims that are capable of doing it. كُتِبَ عَلَيْكُمُ الصِّيَامُ كَمَا كُتِبَ عَلَى الَّذِينَ مِنْ قَبْلِكُمْ لَعَلَّكُمْ تَتَّقُونَ. It's the path to taqwa. And he used the word kutiba, a written. And when Allah subhanahu wa ta'ala uses the word kutib, means there's no change in that law. That law can never be altered. It will always exist. So if fasting is mandated every individual, as it was in the nations before, then that law cannot be altered. But Allah subhanahu wa ta'ala, further after that, in these verses in Surah Al-Baqarah, قال فَمَنْ شَهِدَ مِنْكُمُ الشَّهْرَ فَلْيَصُمْ. If you are to approach the month, if the month comes upon you, then you are to fast. So this is no question about it. We're not trying to say right now that someone out there is excused from fasting if they have no excuse, that they're able to fast. If the month comes upon you, you witness the month, then you have to fast. But subhanAllah, the blessings of Allah subhanahu wa ta'ala, knowing those 5 necessities that He has mentioned, and knowing the principle that Allah subhanahu wa ta'ala has in the Quran al-Kareem, that faith is based on capacity. I want you to remember that. Faith is based on capacity and ability to be fulfilled. لا يكلف الله نفسا إلا وسعها. That capacity is not a one-level capacity. Every individual, every human being is different from another. So what I can do might differ from what a teenager can do. Me in my late 40s or 50s can do something that is more probably able to do than someone in their late 60s or 70s. So each one of us, based on their capacity, physical and mental capacity, is required to fulfill their faith. And that's why we find out that these principles are cemented in Islam. لا يكلف الله نفسا إلا وسعها. إلا وسعها. And that dhamir is returned to you. Each one of us is required individually according to what they can do. And when it comes to fasting, there are 2 elements involved where Allah subhanahu wa ta'ala tied them to the obligation of fasting. Since fasting is recommended by everyone, there are 2 things that can hinder that general rule. فَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ مَرِيضًا أَوْ عَلى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرٍ. So the concept of if you are sick or you're a traveler, then you have the option to fast later days. You still will have to fulfill it, but you have that option that you can fulfill it at a later time. And it's amazing that he mentioned the illness and the travel. These 2 things really are connected. They're linked. The concept of illness, we all know, because if fasting is to restrain yourself from nutrition, and if your body is already weakened because of a disease or an illness that you're going through, then depriving that body from nutrition can only hinder your ability to fulfill your fasting. So the objective itself cannot exist. If the objective is to fulfill the fasting and you are hindered because of your weakness of your physical or mental capacity, then you cannot fulfill your obligation. So if you're sick, you're required to fast later days so you can fast appropriately, fast perfectly, because Allah subhanahu wa ta'ala loves us to perfect our actions. And that illness that you go through differs the extent of it, the extent of that illness, how much of it will hinder your fasting. Usually we ourselves, in general public, have a hard time to determine the nature of the illness that we're in, if it's an excuse for us to fast at a later date. Because remember we said that the month of Ramadan is a month that has been chosen. It has a beginning and it has an end. So we cannot bypass that beginning and end. But to go to a later time of the year, then I have to have that excuse. So when it comes to illness, we would assume sometimes ourselves to be ill and we might not, and sometimes we would assume ourselves to be healthy and we might not be healthy and cause ourselves harm. In that perspective, if we cause ourselves harm, we might even be causing ourselves sins that Allah subhanahu wa ta'ala might take us accountable for, because Allah ta'ala have said, وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ. Do not throw yourselves into harm's way. And this is where our medical doctors come and rescue us from our ignorance. They will help us identify the extent of our illness, the extent of what we're going through, if it's suitable for us to fast or not. And it might be a lifelong reason. It might be a timed reason, a minimal time of reasoning. But we go back into seeing how much we are capable of and what our doctors are telling us, and especially in times of these days where, as we heard Dr. Hassanein just say earlier, yeah, just because you're a diabetic doesn't mean you might catch the COVID-19, but if you did catch it, then you are in a situation that's far worse than an average individual that has it to recover, because your immune system might not be at its best to fight and cure yourself. So at that time, you can, fasting is not an excuse to put yourself in harm's way. I tell everyone, if you are ill, Allah subhanahu wa ta'ala will reward you more for not fasting than he would reward you for fasting here in the month of Ramadan. Especially since you can fast at a later date, and even if you cannot, there's an alternative to it. Allah subhanahu wa ta'ala gave us an alternative to fasting if not fast permanently, which is to feed people that are in need. And that's the whole objective of fasting in the first place. When you're fasting, you're allowing yourself to connect to people that are not fortunate. But if you're able to give them the money, then you're actually doing the objective of what fasting is at the same time. So if you're physically unable to fast religiously, you are not allowed to fast. You are not allowed to put yourself in harm's way. But you need to consult your doctor. I am not a doctor. I am just a faqih that tells you that religiously there's no burden on you if you are sick, because فَمَنْ كَانَ مَرِيضًا, if you are sick. He said, فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرَ, then there are a later days. Consult with your doctor, whether you're a diabetic because of this webinar or any kind of other illness that you're going through. You need to consult with your doctor. And if your doctor tells you you are not to fast, then religiously you are not allowed to fast. It might even be haram for you to fast. If the doctor tells you that your fasting might cause you a definite harm, and you insisted on fasting, even if your intention is in the right place, even if your intention is complemented, the outcome is not. The outcome is not. Let me give you a story of the Rasul with his companions. They were traveling to go to Mecca, and that was the second part of the ayah, O ala safar, and they were travelers. Traveling does not make you sick, but traveling might weaken your immune system, because there's stress, there's the stress level that comes on your body, there's stress level mentally also. As you travel, the Rasul says, "Safar qit'atun min al-'adhab." A traveling is a piece of punishment or torture. Regardless if you're traveling on a plane or by a car, we all know about the jet lag or the stress level, and your body reacts to stress negatively. Your physical capacity weakens from their stress value. So he told the Sahaba not to fast. They were traveling. They were actually going to visit Mecca, and he ordered everyone to not fast. But there was a few of them that insisted on fasting. They saw themselves able to fast. They're strong, they're young, they're fit, so they fasted. Days later, during the journey, they felt fatigued, dehydrated, started to faint, and they were actually delaying the journey of the rest of their brothers and sisters that shared that journey with them. So the Rasul said this statement, listen to this, he said, ذهب المفطرون بالأجر. ذهب المفطرون بالأجر. Those who did not fast walked away with the reward. Look at that. They fasted wanting to seek that reward, and they lost it. The people that walked away with the reward are the people that were not fasting. When we are practicing our faith, the objective is to get closer to Allah subhanahu wa ta'ala. And Allah subhanahu wa ta'ala loves those who take the ease that He offered them, that He gifted them, more so than He loves those who want to be strict on themselves. Inna Allah yuhibbu an tu'ta rukhasu kama yuhibbu an tu'ta azaimu. So when Allah ta'ala wants you to do something and He insists for you to do it in a much strict way, it's equally loved when He wants you to do it in a much easier way. You are doing this for Allah subhanahu wa ta'ala. Let Him guide you. And when He guided you, He said, ask those who know. So when it comes to illness, you ask those people that know, and they will, inshallah, help you out. Ramadan one of the objectives of it is, as you have heard Dr. Hassanein, and also that it helps us cleanse our body and it helps us heal it. Heal it. So if you're already sick and fasting is not going to heal your body, then it's an oxymoron that what you're trying to do. You should be working on healing yourself physically and spiritually. And spiritually cannot heal when you cannot breathe. Spiritually cannot heal when you're fatigued. You know, Rasul Sallallahu Alaihi Wasallam heard that some of the Sahaba were forcing themselves to stay awake so they can pray at night. And he ordered them not to. In fact, Allah Ta'ala interacted with this, and he ordered the Sahaba to read the Quran at night, pray a portion of the night, and made it forbidden for someone to stay up all night under the perception that they're doing ibadah, that they're praying night prayers. And he ordered them not to. Sa'd ibn Abi Waqqas came to the Rasul Sallallahu Alaihi Wasallam. He said, Ya Rasulullah, I love fasting. I love fasting. So tell me what to do. So the Rasul Sallallahu Alaihi Wasallam told him fast Mondays and Thursdays. You know, addition to Ramadan, Mondays and Thursdays. He said, Ya Rasulullah, I'm able to do more. He's fit, he's healthy. So he continued asking for more until the Rasul Sallallahu Alaihi Wasallam says, fast day by day. Later in his years of life, when he grew older and was unable to fast day after day, he said, I wish I would have taken the advice of the Rasul Sallallahu Alaihi Wasallam, because he noticed that if he was able just to do Mondays and Thursdays, he would be more consistent to the end of life than to do a portion and then be forced to stop. Your health comes first, and your faith will be with it, hand in hand. Your faith does not come in second, but your faith is given according to what your health is capable of handling. And if you do that, then they both will go hand in hand, inshallah, and your reward from Allah subhanahu wa ta'ala would be blessed. The bottom line is, number one, we're not asking anyone to walk away from their faith and walk away from Ramadan. We're anxious to see Ramadan. But if you have other complications in life, I'm a heart patient. Myself, I'm a heart patient. I consult with my doctor every time I want to do something. It might jeopardize my well-being for myself and for my family, as well as for my community, because if I'm unable to produce, my community also is suffering. So number one, your well-being. You need to take care of it. You cannot do it on your own. You need to consult with the medical personnel, and that's an order by Allah subhanahu wa ta'ala. وَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Ask those who know. If you do not know, even if you think you know, you should consult your doctor. For every incident or every situation has its uniqueness. And for a diabetic patient to ask before the COVID-19 is different than asking during the time of the COVID-19. So you need to ask. Number two, when you are not doing Ramadan, for example, if you're not fasting because of your medical reasons, you're not neglecting your faith. You need to understand that. So you don't need to feel bad about yourself. You don't need to feel that you have missed an opportunity, a religious opportunity. On the contrary, you're rewarded just like everyone else. Listen to this hadith. Rasulullah was traveling with the Sahaba to Tabuk. Traveling to Tabuk for the Battle of Tabuk was mandated on every individual person in the community that's capable of traveling. But there were some people they could not because of financial or physical reasons. And while the Rasul with the Sahaba, he heard them on the way that they were complimenting themselves for traveling with the Rasul while feeling sad for those who are left in the city. So the Rasul says, Wallahi, there are men and women, listen, there are men and women in the city of Medina. There's no valley that you walk down to or a hill that you climb that they're not with you. What kept them away is an excuse, a valid excuse. So number two, you need to understand, if you're unable to fast on Ramadan, but your doctor told you not to, because your body cannot handle it, you're still being rewarded just like if you were to fast. In fact, you're probably rewarded more because you listened to the command of not fasting, even though you wanted to fast. You stayed back and you're rewarded for listening to the order and rewarded for the fast in itself. Three, there's always other ways to make up for what you're missing. There's later days that you can fast, and there's also ways that you can feed the needy that make up for the days that you have missed. Our deen is merciful. Our faith is gentle. It's also kind to us. It's kind to us and gentle to us and merciful to all. Let us embrace it from that perspective. Wallahi, if we do, we'll love it even more. Jazakumullah khair. Barakallah feekum, inshallah.
Jazakallah khairan, Sheikh AbdulHakim. That was an amazing, inspiring information. SubhanAllah, we have a beautiful religion, and sometimes we just make it more complicated. It's amazing how to know that Allah la yukallifu nafsan illa wus'aha, and Allah yuridu bikum al-yusra wa la yuridu bikum al-usra. So that's amazing to know that, in spite of what we heard from Dr. Hassanein, that most people can fast Ramadan safely with the exception of few sicker patients. In spite of that, you telling us they are forgiven and they have other time to make up for it, which is amazing, and that's the beauty of our religion. In the context of the COVID-19, and that's why we're doing a lot of this talk to inspire people and give them some information. I'm going to ask you a couple of questions. One is harder than the other and more heartbreaking, but I'm just going to give you two examples that I personally had to go through and people I know. So the first question, we have one of our community members. She's young, beautiful, new to Islam, and this is going to be her first Ramadan fasting. And we all know and we all enjoyed the multiple Ramadans that we fasted. It's a community thing. We go together, we eat together, we pray Taraweeh together. So now this year is going to be hard for all of us, and especially for people who are new to this religion or didn't used to do these rituals. Is there anything you can, I'm sure probably you have to talk about it in the other webinars, but it's just some simple advice to all of us. What can we keep connected spiritually? How are we going to do Taraweeh by ourselves? It's just some inspiring ideas.
Okay. Well, first of all, Ramadan really has four main components to it. One is restraining from food and water from dawn to sunset. So the fasting is really not a place, but it's an act. So if someone is capable of fasting, regardless of the COVID-19 or not, you still are able to refrain yourself from food from dawn to sunset. So that concept stays intact. The second is our connection with the Quran al-Kareem. شهر رمضان الذي أنزل فيه القرآن. And reading the Quran al-Kareem is not also connected to where we read it, it's when we read it. And we can read the Quran al-Kareem throughout the whole day. In fact, every year when I review my Quran during the month of Ramadan, I rarely do read the Quran sitting in the masjid. I usually do it while I'm driving to work, returning from work, and other times that I can steal time to read the Quran Kareem because of our schedules. So she and all of us can still read the Quran. In fact, we even have a better opportunity now that we are staying at home, that we can go back to the Quran, not just read it, also study it and get closer to it. I usually review one juz every day. Since I've been staying home, I've been doing between 5 to 10 juz every single day because there's not much else one can do. The third component of Ramadan is the sadaqah. And the sadaqah is still there. There's still people out there that are in need, in fact, even more so these days than any other days in our past history, because a lot of people have lost their jobs. Even those who are back in the Middle East, many of them were dependent on people sending them money from here. Now the people that are here are suffering themselves, so they're not able to send as much as they usually were able to send. So we still, if we're able to come together and put that nickel and dime and penny together, we can still generate hope in the hearts of those who are less fortunate. So she still can do that sadaqah even more. And then the fourth, which is the prayer itself. Ramadan is known for its prayers, and people tend to reflect on Ramadan with Salat al-Taraweeh. I would like to say, Salat al-Taraweeh, Rasul Sallallahu Alaihi Wasallam, when he first started, he prayed the first night Taraweeh in the masjid. Then he prayed the second night in the masjid, and then he prayed the third night in the masjid and did not return again to pray in the masjid till he passed. He never prayed Taraweeh in the masjid again. And when he was asked, he said, if I had came out for the fourth night, it would have been obligated. So he continued to pray Taraweeh at home. And likewise, the majority of the Sahaba, they used to pray Taraweeh at home, not at the masjid. The only time it became a ritual done in the masjid is during the time of Umar ibn Khattab. He recognized that people started not praying at home. So he wanted to bring them back to the masjid so they can more so support each other and encourage each other. And then all of a sudden we have Salat al-Taraweeh the way we know it today. We might not have that congregational prayer in the masjid this Ramadan, but we still can pray Taraweeh at home. Taraweeh still should be done. So we should not miss anything. I don't know anything that can be missed in the month of Ramadan this year except sitting together as families and friends and having together. But other than that, every practice that we have, we still can do. Some people have said, can we pray Taraweeh listening to an audio or an imam from a different location? Unfortunately, prayers have to be connected physically, but that doesn't mean I can't listen to Quran from an imam from a different location. It's just that when I do my prayers, I do it alone. I can use the mushaf if I don't memorize much of the Quran and read from the mushaf. It's okay, even if your prayers, because Taraweeh itself is a sunnah. It's not obligatory. It's a sunnah, so you can use a mushaf. In fact, the Rasul sometimes used to pray sunnah on his mule, on his camel, and the camel would even change directions, and he would not disconnect his prayers. We have, listen to this. I know the time is in essence, but this is a solitude. We can take it from a perspective of solitude, not isolation. This is how I look at this right now. And if I look at the greatest men and women in history, Allah Ta'ala brought them solitude at time to strengthen their faith, to make them stronger. Musa alayhi salam, he was called for 40 days away from everyone. He came back with the 10 commandments and came back stronger than what he had when he left. Rasul sallallahu alayhi wa sallam used to spend nights in the cave all alone to wonder about the universe and explore the inner thoughts of himself. And through that, he recognized the truth of the oneness of Allah subhanahu wa ta'ala before the wahi even came to him. Before Jibreel even revealed, Iqra bismi rabbika alladhi khalaq, Rasul sallallahu alayhi wa sallam already identified there's only one creator that can exist. Yunus alayhi salam fled his people and lost contact with them because he miscalculated the time to leave. He had to spend many days and nights in the belly of the fish to reflect, to recognize where he went wrong, and he returned to people that were welcoming to him. These solitude moments are a blessing sometimes. Even us in Ramadan, we have i'tikaf. 10 days, the last 10 days of Ramadan is a sunnah to do i'tikaf. What is i'tikaf? Is to isolate yourself in a corner of the masjid where you stay away from your family and friends and loved ones, and you just focus on your spiritual uplifting and growth. Now we have that opportunity. We're staying home, not by will, but by necessity. Maybe we can use this to uplift our spirituality in this month and moving forward.
MashaAllah, this is amazing. It's just, you're a very inspirational person. It's just like you turned something that sounds so daunting to an amazing half full type of a thing. You just look at things from a very different perspective than all of us. That's just amazing and eye-opener. And I thank you to highlight the more important four corners of Ramadan that inshallah still be intact, and inshallah we've come out of this Ramadan even stronger than before. The second question, I'm not sure, Maryam, do we have time?
Yes, absolutely.
Okay, perfect. I just don't want to get too long, but I'm sure that's on a lot of people's minds. And it is a bit sad, is death with the COVID-19. Unfortunately, I personally experienced family member tragic death young in another state, and I could not end the janazah. Muslim people are dying by themselves alone, not even with a chaplain or not even with a Muslim family member around them when they're dying. I wonder if you can enlighten us with things that, like, what can we do when we're far away from loved family, when this tragic thing happens as a Muslim person? What's the best thing that you can deal with this? And maybe you can enlighten us with something amazing as with the fasting.
You know, first of all, may Allah subhanahu wa ta'ala have mercy on all of those that have died. May Allah subhanahu wa ta'ala accept them among the righteous of his servants and have their grave, Allah, the gardens of heaven. It is a trial. Death is imminent and real. الموت كأس وكل الناس شاربه والقبر دار وكل الناس ساكنه. Death is a drink that we'll all have to sip from, and the grave is a place where we'll all have to live in. So it's a fact, and yes, we have different reasons of dying, you know, but at the end of the day, death is the same. And unfortunately, these days, we have a lot of people dying in scores, and some of them are Muslims. May Allah subhanahu wa ta'ala have blessings with them. If a Muslim dies, there are a few things that have to exist for them. One of them is the burial itself. They have to be buried, and they have the right to the right burial rituals. The right burial rituals. And that right burial rituals comes first by the ghusl itself, the washing. And when we say the washing is the preparation to have someone cleansed for his ultimate meeting of the angels in the grave. And I've heard these days that it is hard to wash a body in the way that we do it because of the infectious possibility that the people that are washing the body might be infected. There is a fatwa on amjaonline.org, amjaonline.org. We had a meeting a few weeks ago, and that fatwa came on how to wash the body that died because of the COVID-19. To where the people that are washing it are protected. I would advise everyone to go back to that fatwa. I'm not going to get into it because it's a long process, but in general, the body is still going to be washed or prepared. The second part of the rites for the deceased is the prayer that we pray Salat al-Janaza. Salat al-Janaza is mandated by a group, and the group in Islam is two or more. So if there are two people that are praying the Janaza, then that should be enough. And they can do it at the cemetery, or if they're doing it at the morgue. As long as there's two people praying, then we have fulfilled our obligation. And I've attended a burial just recently for someone that died because of the COVID-19. And we prayed Janaza at the cemetery, and I think we took the precautions of not being infected by the deceased because he was in a plastic bag, and as well as in a casket. So there was a lot of precautions there. If you have lost someone that's in another city, obviously, most likely they have prayed Janaza for them. But our scholars have said if it's an immediate loved ones to your family, you can pray Janaza for them, even though you're not there with them. An absentee Janaza, like the Rasul ﷺ prayed Janaza for the Najashi. Najashi was a Muslim, but no one knew he was a Muslim, so Rasul ﷺ prayed Janaza for him. But the scholars have said over time, if it's someone that have provided the Ummah with exceptional services, or someone that is closer to you as a parent or brother or sibling or so, family member, that you're not there in their presence, you can pray Janaza. And I do not want to forget that you can also give sadaqah in their name, and they can be rewarded for that, inshallah subhanahu wa ta'ala. We're a family. Diseases don't disconnect our souls and our hearts. It might disconnect our bodies and our contact, but it doesn't connect who we are with whom they are.
Jazakallah khairan. That's amazing. I mean, we have a group here with Muslim physicians in Columbus, and they've been circulating a nice PDF one-page form is to give to the healthcare providers, like the non-Muslim staff or nurses that attending the last minutes of the Muslim patient, and just direct them as how can they help with probably reciting Quran for them, like open the iPad for Quran, and how to contact their family to prompt them to make shahada before the last few breaths. So if interested, we can circulate that through the IMANA website. I think that will conclude our question and answers, and I want to leave some more other questions answers for the live audience when hopefully we do that live. I think I'll leave that to Miriam to conclude the session, and I really jazakallah khair of both of you, Dr. Hassanein and Dr. AbdulHakim. It's just been amazing. I enjoyed it as much, and I hope the others will.
Jazakallah khair. Thank you.
Thank you very much. Thank
Yes,
you.
I was going to say, I completely agree with you, Dr. Ghalib. Thank you both so much. I just want to remind everyone that, inshallah, we will have DAR's website, and this webinar obviously sent out to everyone, but we'll have DAR's website on IMANA's website. So if you please go to www.imana.org, there will be a link for the coronavirus information, and inshallah, we'll post DAR's information there. And as always, so thank you so much, Dr. Hassanein, and thank you, as always, Sheikh AbdulHakim, for your words of wisdom and inspiration. And just to remind everyone, he's doing a spiritual preparation series of webinars for prior to Ramadan. So the next one will be April 16th and April 23rd at 8:30 p.m. Eastern Standard Time.